Welcome to the National Health Education Standards and its relationship to health education and the Health Education Assessment Project. I'm going to ask you to think before we begin, and so you're going to need a piece of scratch paper and a pencil just to be able to write a few things down, a couple predictions, so as we move along we can see how well you relate to the upcoming information. Before moving to the next slide, I'd like you to predict what the leading causes of death are for the 10 to 24-year-old age group. See if you can jot down 3 or 4. Okay, let's move to the next slide to see how accurate your prediction was. According to the Center for Disease Control, the leading causes of death among persons ages 10 to 24 are motor vehicle crashes, other causes, unintentional injuries, homicide, and suicide. Many people aren't surprised that among this age group, motor vehicle accidents and unintentional injuries are reported so high because we hear about it so often. But surprisingly, homicides and suicides are there. Some wonder what the HIV/AIDS rate. Well, for causes of death, this is the time of transmission during this age group, not necessarily time of death. And so we're going to look at transmission rates in a few minutes. Now let's review some data on teens revealed through the Youth Risk Behavior Surveillance System, better known as the YRBSS. Among 13 to 21-year-olds, about half of all new HIV cases occur. The highest risk population are our teenage girls, and particularly our African American black teenage girls. Each year there are 3 million STD cases reported and 1 million pregnancies. In terms of HIV/AIDS transmission rates, if you look at the population on the right for this data, out of 34 states, 62% of the teens were white, 17 were black African American, and 15 were Hispanic or Latino. If you look on the left, you can see how disproportionate the percentages of HIV and AIDS cases are, where 72% of our black African American teens make up that portion of the pie. Transmission rates among male adolescents and young adults. Male-to-male sexual contact is still a high-risk transmission category for HIV, followed by IV drug use, and also high-risk heterosexual contact. Transmission rates among our female adolescents. High-risk heterosexual contact is the highest risk group, followed by IV drug use. What percentage of our students have ever had sexual intercourse? Well, surprising for some people, males and female rates are about the same. About 46% of our students overall have reporting having had sexual intercourse. We can see that our black teens report higher experience with ever having had sexual intercourse. Carrying a weapon. It doesn't say gun, but carrying a weapon to school property. About 5.6% of our students report doing that, 8% males, and among white, black, and Hispanic teens, statistically about the same. The next slide is about what percentage of our students have ever drank alcohol. What do you think the prediction is? What percentage of our students do you think reported in the YRBSS that they ever drank alcohol? Well, if you said more than half, you were right, about 72.5%. You can see that the percentages between male and female aren't that disproportionate, but our white and Hispanic teens' experience with drinking alcohol is reported a bit higher than our black or African American teens. For future discussion, we're going to think about the data we just reviewed. Now, on your same piece of scratch paper, I'd like you to list the answers to the following questions. Listing them now is going to allow you to review the information to see how well you relate to the upcoming data. What are some of the health behaviors that contribute to some of the leading causes of death? I'm going to give you a few minutes to jot those down. Based on that information, what content areas would you include in your health education curriculum? So we listed some of the health behaviors based on motor vehicle accidents, unintentional injuries, homicides, and suicides. So based on that, if you were writing curriculum, what content would you want to include? Okay, now what skills should a high school student have to be able to implement that content effectively? We've identified the health behaviors, we've thought about the content. Now what skills would we include? See if you can jot a couple of those down. Now, identifying 3 high-risk behaviors: weapon carrying, alcohol and drug use, and sex risk behaviors seem to be able to be easily identified in terms of some of the high-risk behaviors our teens avoid and that lead to the leading causes of death. Some other behaviors that lead to unintentional injuries are violence, tobacco use, alcohol, drug use, sex behaviors. And if we look at our high obesity rates, we know that unhealthy dietary behaviors along with poor physical activity would be listed there as well. Now, among those 6 preventable behaviors that we've identified and we've established as that they occur as teens and they extend into adulthood, we know that the overall cause is poor health, poor diet, and poor social outcomes. 2/3 of adult deaths occur from cardiovascular disease and cancer. Typically, these are linked to 3 behaviors that start during our teen years: tobacco use, poor diet, and lack of exercise. The National Health Education Standards focus then is on health skills, providing the foundation for curriculum, instruction, and assessment, as a guide for teacher preparation, and the standards are based on health literacy. So what's health literacy? Well, the definition is it's the capacity of an individual to obtain, interpret, and understand basic health information and services, and the competence to use such information and services in ways which are health enhancing. So breaking that down, it's about concepts and skills, being able to have factual information and also having the skills to be able to use that information effectively. The National Health Education Standards then reflect healthy, literate people by identifying the standards. 1, a healthy, literate person can think things through and make healthy choices in solving their own problems, are responsible and make choices that benefit themselves and others, are in charge of their own learning, can use communication skills in clear and respectful ways. And that brings us to the National Health Education Standards acronyms. First, the factual information, the core concepts surrounded by the skills: accessing information, self-management, analyzing influences, interpersonal communication, decision-making, goal-setting, and advocacy. So how did the Health Education Assessment Project become organized? What was the foundation? Well, there is an assessment framework, and that's a little bit different than the curriculum that we think of, because the priority is on skills and the concepts that are used for assessment. The assessments were developed by looking at all the possible skills and concepts that could be assessed. Then they linked each skill and concept to a grade level, and then they ranked the importance of each skill and concept. The three models that were examined were the National Health Education Standards, CDC's Adolescent Risk Behaviors, and then the traditional health education content areas. One of the driving forces was the YRBSS. The focus was for the content area, and that was designed to identify what those leading causes of death were in the young adults. We're going to look at a cube in a minute, which is really kind of the conceptual framework. It allows you to kind of look at how the HEAP framework interlinks. You can see the grade levels to the front. On the top are the concepts of skills, and then the content areas. A few minutes ago, we asked you to list what some of the content areas were that you would want to include in your curriculum. Of the 9 that are listed, how many of them did you include? And then we also asked you to identify some of the skills. Most of us are probably doing a pretty good job. Here's another way to look at it. On the left are the common health education content areas, and then the risk behaviors. And you can see how they're integrated among the National Health Education Standards. Standard 1 are your core concepts. Standard 2, analyzing influences. Standard 3, accessing information. Standard 4, interpersonal communication skills. Standard 5, decision-making skills. Standard 6, goal setting. Standard 7, self-management. And Standard 8, advocacy. Now let's talk about the assessment framework. These are standards-based health education assessment items. The importance is they have content validity. This has been years in the making. And what's wonderful about the health education assessment items is that they're ongoing. There's a team of professionals that are constantly looking at the validity and are constantly adding items to the assessment bank. You're going to have the opportunity to look at many of these assessment items on day 3 of the course. The Health Education Assessment Project assessment items are items that we're pretty familiar with. Selected response or multiple choice questions, short answer items that require students to write a paragraph in response to a prompt, the extended constructed response, which requires students to write an essay in response to a chart, graph, or diagram. You know that through the PSSAs and also the Keystone exams, our students are required to practice writing as much as possible. Performance tasks people often refer to as their projects, things that students work on over an extended period of time that they either do inside or outside of the classroom or a combination, and then our student portfolios. The mission of the Health Education Assessment Project is to have assessment resources and to increase our teachers or our members' capacity so that they can align their curriculum, instruction, and assessment, and then overall to improve student health literacy through improved health instruction. I hope this overview of HEAP was helpful. We're going to break it down as we move on throughout the course, but this was the initial framework. Feel free to review if you feel necessary, but I think that this framework will help guide you as to what's upcoming in terms of the important concepts and skills and the National Health Education Standards.